Hi guys, and welcome again to my channel. Uh, this is Crazy Limited Edition Series, Episode 3. And in Episode 3, we're going to be talking about anxiety. So, anxiety is classified as a mental disorder. Uh, Severe cases of anxiety could be classified as mental illness. So, people with anxiety have been known to experience such symptoms as fear, anxiety, irritability, loss of concentration, hypervigilance, irritability, I've said that, lack of sleep, racing thoughts. So anxiety, uh, well, personally, I don't know what to tell you. Anxiety is like anxiety, yeah, but in this case, it's been recently instituted as mental disorder, So certain patients who have been exposed to diagnosis by specialists usually end up being categorized as mental patients, right? So, there are mental patients. They are under medication. Some of the treatment is therapy. I've seen that people with extreme cases of anxiety have to go to therapy as practically their medication. Uh, so anxiety, yeah, it's pretty weird, right? Uh, some some could say that you have lost your mind because of stuff like hyperventilation, uh, fear, seeing things that are not there. So yeah, anxiety, mental illness. Is I don't know if I'll say it's recently been introduced as mental illness, but what I will say is that it's actually a pretty interesting something to carry. Now, personally, I wouldn't say I've experienced anxiety myself because technically anxiety is uh, the exact opposite of my personality, right? Because I'm a bit outgoing, a bit bold, a bit ambitious and greedy. Those are my characteristics, and so it's known to have like shy people, quiet people, indoors people. Uh, you'd find like they'd have a problem talking in public or like in a crowded room. They would get heart races uh, when they're around family members, strangers, older people. So, someone with anxiety is someone who's experiencing the world in his own fashion. But those are like extreme cases. Most people with anxiety just have encounters like strokes, something similar to strokes, like you are in a weird position and you end up uh, hyperventilating, like getting loss of breath, shortness of breath, breathing. So, anxiety, yeah, it's mumble rap, yeah. because the series is mumble rap based, it's definitely mumble rap, right? If you can see, Austin put it as episode 3 in his mumble rap series, right? Crazy. So all of it is mumble rap, right? See, it's mumble rapping right now. Yeah, but yeah, it's style, it's fashion, it's designer. If you ask me, uh, it's classic. Uh, I don't know how that would work really. Uh, I would post it and then you would want to rock it. No, it's like, see, I'm a mumble rapper, right? And this is what I'm dressed in, right? This is what I'm pulling up to the scene in. Anxiety, episode 3. So, yeah, it's fashionable, but it's exactly what I'm rocking. Now, uh, so I'd like to know what you guys think. Like, this is my new style of, this is what I've dabbled in the case of mumbling. Like, I've dropped Anxiety episode 3 and it was mumble rap, and I would like to know if you guys fucked with it, right? It's my new style, right? I'm revolutionizing the craft, really, and doing it all different and making everything better. So let's go back to our topic, anxiety. So, uh, anxiety has been known to be exposed to, like, even like kids could experience anxiety. Older people, shy people. But what I will say is the extreme cases which are untreated, those are the cases which we would call mental illness. Now, I think personally, it's not about going crazy. It's really about the issue you're having. You won't have like anxiety, and the fact that you experiencing it is what we consider mental illness, right? Yeah. So, anxiety, episode 3, crazy. I hope you enjoyed it.